super curious about how an implant placement procedure is done, and I'm sure our audience is too.
Yeah.
So could doctor walk us through the steps from A to Z?
The first picture is a conventional guide that I actually used it back then before we started the digital guide. After we do the marking, then we will actually make the incision, and then upon flat elevation, then we will make osteotomy. This will prepare the bone. Alright, and the third pictures that you can see is actually the parallel pin. So I like to take a periapical radiograph, the X-ray, by using the parallel pin. Once I confirm my working length, alright, and my positioning, I will further enlarge the osteotomy site to the implant diameter that I want. Okay, for this case, for instance, it's a 3.3 diameters, and then we check from occlusal view, from buccal, from mesial distal, all the position is correct. Then only we will place the dental implant for the patient. So moving forward, as for this case, I place a dental implant and then followed by bone grafting during the same procedures. Because it's an anterior case, so I actually use a BioGuide and BioOs for this patient. BioOs is actually a xenograft. Because the membrane is quite, one is wet, soaked with the blood, is quite difficult for us to shape. So I made a surgical sterile template for me to shape accordingly, make sure it's good. Then only I will cut on the actual membrane so that I will not waste it. After the bone graft being placed, then we put the cover with the membrane, and then we test the flap. Make sure it's tension free, and then we just suture it so that we can get primary closure. You can see I actually didn't give patient any denture after that, but instead I used the neighbored tooth. I put an artificial tooth, and then I etch and bond with some composite, right, so that the patient go back with the tooth inside but without the denture, to minimize any potential micro movement caused by the denture. So you can see from these images, it started with the bone is like this, a concave. After we do the bone graft, we managed to build back the bone, okay? And then subsequently, after 4 months, I actually exposed the surgical site once again. So from my healing abutment, I changed to a temporary abutment, and then I insert soft tissue graft for patient, and I make a temporary crown for patient. So this is how we shape the surrounding soft tissue after we added the soft tissue graft for patient.